And that is critical. Because what that will allow us to do as a team is to go back and look at movement. To go back and look at movement for ourselves and for our colleagues. We'll be able to go back and look at movement and see who changes movement the fastest. Okay? If the test is sensitive and it's objective, then we can start to look and see who changes movement the fastest. Because then what we can do as a team is say, okay, what are you doing? What is it different that you're doing that's driving these big changes in movement? And then that can drive our correctives. Okay, that's exactly why we have built this system the way that we have. Because I want you to challenge yourself. I want you to be able to look at the information and to create collegial relationships with your colleagues, that if you see people making big changes in movement a little bit faster, is to say, what are you doing? With your patellofemoral patients, I noticed that you make a change of 50 points between exams, and I'm making 35 points of change between exams. What are you doing differently? If the number of sessions are the same, if the diagnoses over time, because you're collecting a lot of data, okay, and you get, it's different if you treat 1 or 2 patellofemoral patients versus 150, right? Then you can start to get some trends, okay? But my challenge to all of you is to do that, because that's why we built the system the way that we did. I'm not saying I'm the smartest guy in the room, and I'm not saying I create the best exercises in the room, because this is a very creative group. And somebody in here is going to add something really significant to the correctives and the way that we change movement. But the only way we're going to do that is if we do some comparisons. And comparisons to drive movement in a better way. Does that make sense?